Aloha, I'm Dr. Scott Sanderson with Elite Health Hawaii, and today I'm going to talk to you a little bit about, for some people, is an uncomfortable subject. A lot of men have a lot of difficulty talking about erectile dysfunction, but it's something that's very common, and it's a subject that we take seriously here at Elite Health Hawaii because good sexual function and good sexual health is a very important part of every person's life. So we actually have some cutting-edge technologies to address the underlying issues that cause erectile dysfunction. And we have full protocols that we set out and individualize to each patient to address each man's level of erectile dysfunction. So a couple of the options that we have, we can start off with, sometimes we use some medications to supplement these things. That, of course, depends on patients' preferences and also depends on their level of dysfunction. Sometimes men very often actually need to have their hormones balanced. So too much estrogen can cause erectile problems. Not enough testosterone can cause erectile problems. Too much stress hormone. So we look at all the hormones that a man has and we balance those hormones. And by balancing the hormones, we can sometimes help improve the erectile function. Now, some of the other things that we do to improve erectile function in men would include the P-shot and also CaverStem. So, they're similar procedures, but different in some crucial ways. The P-shot is where we take platelet-rich plasma and inject it into the spongy tissue of the penis. Now, the tissue in the penis is like a sponge, and with time it sort of degrades and it breaks down. So a lot of men will notice that they have decreased firmness in their erections. Their erections don't last as long as they used to. Some men even notice when they look down at themselves, they just think, man, I'm just not quite as big as I used to be. And that is because of the degradation of that spongy tissue. And as that degrades, the quality of the erections will degrade as well. And oftentimes the sensitivity of the penis will be decreased as well. So we take the platelet-rich plasma, which is full of growth factors from your blood, and we inject it into that spongy tissue, and that gives a very strong stimulus for that spongy tissue to regrow. And with the regrowth of that tissue, we see improved firmness in the erections last longer, men have improved sensitivity, and they oftentimes see an increase in size as well, sort of a return back to where they were previously. It's kind of like putting the penis almost in a time machine and just taking it back a few years so it functions like it used to, and improves our sexual health, improves the way that we live. So the other things that we have to improve erectile function would be the CaverStem. CaverStem is a similar procedure to the P-shot or the PRP injections. However, it's much more powerful. So we're actually taking stem cells and harnessing the power of stem cells, which is the ultimate healing process in your body, the ultimate healing tool or equipment, if you will, in your body to really regrow those tissues. So it's a two-step process. We take the stem cells out of your bone. So of course we numb everything up, and the patient is made very comfortable during the procedure. We go into the bone in the hip, take a little bit of the bone marrow out. Now the bone marrow in that area is full of stem cells, and CaverStem has come up with a proprietary line of equipment that allows us to harvest more stem cells than any other line of equipment has in the past. So we're getting more stem cells with this one tap than people are getting in the past with 6 taps. So the number of stem cells is very important in the level of effect that you're going to have. So we take these stem cells out of the bone marrow, process them minimally, and then after we do a nerve block on the man's penis, then we inject those stem cells into the spongy tissue of the penis. So that gives a very strong stimulus for growth of those cells. So all of those little cells inside that sponge which were degrading previously are now going to grow back to how they were before. So now the erections are going to become much more strong. They're going to last much longer. The sensitivity will be improved, and then of course if the man has lost any size, he's going to gain that size back as well. There's a few questions that people have about the procedures. Which should I get? Should I get the P-shot or should I get a CaverStem? A man who has just a small decrease in erectile dysfunction and who is otherwise quite healthy may be able to get away with just one P-shot. A lot of men will need multiple P-shots. But for any man who has, up to at least moderate level of erectile dysfunction or loss in function there, he's probably going to want to go with a CaverStem just because it's so much more powerful. It's probably the equivalent of doing at least 3 PE shots. So far, the urologists that we've seen doing these CaverStem procedures have been getting amazing results. Have a lot of very happy clients.